Good day, everyone. I'm fortunate to have with us today Dr. David Kershenobich from Mexico. He's one of our 2020 Global Hepatitis Elimination Champions for his remarkable work to advance implementation of birth dose hepatitis B vaccination and then improving access to hepatitis testing and linkage to care and treatment. We're very fortunate to have David here today to tell us a little bit about himself and about this work, which has been so remarkable and so impactful for the country of Mexico. David, welcome. Please introduce yourself and let everyone know, your position and a little bit about yourself in your life in Mexico, please.
Thank you very much, and I'm very thankful for the Coalition of Global Hepatitis Elimination and for the task force for this award. Let me tell you how I started my interest first in liver and then get to hepatitis. When I was a resident at the National Institute of Nutrition in Mexico City, Professor Sheila Sherlock came to the Institute and asked us to present some cases. At the end of my presentation, she approached me and she said, "You have to come to work with me." At that time, I had applied with Dr. Popper in New York, and she said, no, I'll write to Dr. Popper. We didn't have all these materials like we have now, all these technical ways of communication. So the next thing I had was a letter from Professor Sherlock telling me that she had spoken to Dr. Popper and I should go to England. And that's the way I went to England with Professor Dame Sheila Sherlock. And destiny is very good, because at that time when I arrived there was the time that hepatitis B virus was being described by Dr. Blomberg. And so we start to try to understand hepatitis. Later on, we had the opportunity that Dr. Blomberg visited us at the Institute, and we had the opportunity to listen to him in person. So that's the way we got to know hepatitis B. So back in 1998, when we decided we would like to have a Mexican Liver Foundation, which is now called Fundepa, because we decided not to focus on the disease, but in the prevention of the disease. So we looked for somebody to sponsor the foundation, and we met with Mr. Antonio Ariza, who was a philanthropist in Mexico. And he said to us, before we make the Mexican Liver Foundation, we would like to have a cause, not the foundation, but to have a cause. And we decided on two things. One was to work to get the goal, through the goal of hepatitis B vaccination in children in Mexico. And the second one was to support people that did not have the resources to go to a liver transplant. That means very poor people that we would support with medicine for immunosuppressive treatment. So we went to see the minister, and we also lobbied in the Parliament of Mexico to see if we could succeed to have a vaccination program for children. And we were fortunately enough to get the support of the government, of the Minister of Health, Dr. De La Fuente, and then the support of the Parliament to get the program of vaccination. I have to say that so far, approximately 20 generations have been vaccinated for hepatitis B in Mexico, which makes up to almost 40 million of people being vaccinated. The Mexican Liver Foundation continued its work. We had other philanthropists coming in, such as Mr. Rubén Aguilar and his daughter, Luz Maria Aguilar. And the foundation kept expanding its purposes. At that time was when we first learned about hepatitis C. And I have to say we were not very successful at the beginning, because when the interferon and the first direct antiviral agents came into the ground that we knew about them, Mexico was not very successful in implementing the access to those treatments. So by the time the direct antiviral agents came into the market, then we decided that Mexico would have to be able to participate immediately from this benefit that the direct antiviral agents would bring, and we should not lose the time like we did at the beginning of hepatitis C with interferon and the other antiviral agents. So we started to work again with the authorities. We first organized meetings with the social groups of Mexico City, trying to get the interest of them to be able to access to the medication. As you know, one of the main hurdles we had to do with the pricing of the medication. So learning from what had happened in other countries, we decided that we needed the government participation, we needed the health authorities participation, we needed the social groups that participate in these efforts to try to bring them, all of them together, to try to make a comprehensive approach on how to be able not only to access to treatment for some of them, but to access with equity for everyone in the country. And we spent months of lobbying and working until we finally were able to develop a program in which the government had enough precision to know how many treatments they would need, because they were not able to release the approval if they didn't know how many individuals would actually require the treatment, and to know from the economical standpoint of view how much that would cost. So in an effort to eliminate hepatitis through the country. So once we were able to set up how many would be the population we could do in 10 years, because we wanted to eliminate it according to the standards of the WHO. So once we knew the amount, then the next step was to go to the health authorities to speak with them about the advantage of treating hepatitis C, because approximately a quarter of the patients that we have with liver cirrhosis, or a quarter of patients with hepatocellular carcinoma, were actually due to hepatitis C. So once we had that, then the next step was to go with the private companies of the medications to tell them that we have a joint responsibility, each of the parts, to develop a program that could assure us for the next years to come access to treatment. And we were fortunately, after a lot of different sessions, to come up with a program which is now in place since October 2019, in which every Mexican, irrespective of if you have Social Security or if you don't have Social Security, or if you don't have access to any of the systems of protection, would receive the treatment in order to try to eliminate hepatitis C by 2030. And I have to say that we were faced then with one achievement, but we were faced with bigger problems. And the bigger problem was how to assure the testing of the population, how to assure the access to the treatment. The implementation actually proved to be a very risky factor that we had to approach. So what we did is we set up, we took advantage of the fact that Mexico had already a program for treating HIV patients, and they have a setup of clinics throughout the country. So by using this structure as an important an important component in these centers, the responsibility of the program was given to the committee that treats HIV. And they started to develop a program in these centers and also to expand to the primary health level of service in the country. So we set up an education program for general practitioners in order to be able to prescribe the treatment, but also to be able to recognize who has complications of liver disease and send them to the hepatologist or to the gastroenterologist in a referral. We also set up a platform in which we spent more than 6 months implementing a registration program that if the patient moves from one part of the country to the other part, he would have access to the platform in order to be able to follow the patient. So that's the way we're trying to approach. And we also developed an observatory, which is monitoring on a weekly basis the program to try to be able to have enough data of how the program develops. So this is a summary of more or less of how we're working with hepatitis in Mexico. Now, your microphone.
Thank you. It was certainly more, not less. That's a very nice description of a lot of critical components that have made you successful through the years. You mentioned being trained by Dame Edith Sherlock, and she's trained a number of hepatologists who have made remarkable contributions all around the world. I'm interested, you've done so much work on the prevention side and access side, that really the public health aspects of medicine, but then you were trained, as rigorously as a hepatologist. I just would like to understand, how did you get off onto this very, impactful public health work rather than just focused on, clinical medicine, which is also needed, of course. Just interested in what made you take that direction in your career.
Well, I think that has to do with working at an institution that is dedicated to good quality of care for patients, teaching and research. And by having these 3 characteristics, we are an institution that has to do with global health impact. The National Institute of Nutrition was created in response to a malnutrition problem about 76 years ago. And that's how it was born, because of the problem of nutrition. So it's been a tradition to look to global health. The institution serves different places outside and does modeling studies in the sense of nutrition. Right now, it's not only undernutrition, but obesity. So we have that all the time. And then the Institute is dedicated to non-communicable diseases, diabetes, obesity, etc. And that also has an impact on global health. And we also develop models of attention. So for the last, I would say, 7 years, we have decided to change the model of attention of a patient from one-to-one in a visit to a visit in which we get several specialists participating in the attention of a patient. So a patient may come to the institute and he, instead of spending half an hour, he probably will spend 4 or 5 hours until we get a comprehensive approach. So I think all this has impact on me on the sense of global health as an important factor. And I think this is very relevant in the sense of hepatitis.
Thank you. Thank you very much. One other follow-up in your description of what you put together to have hepatitis B vaccination become a routine vaccination for children, and then what you put together to have access to these new curative treatments for hepatitis C. You really went into a great detail about the necessary partners that you need around hepatitis C. You mentioned civil society, the value of data, obviously the importance of working with government. And you know, for us at the Coalition for Global Hepatitis Elimination, we're all about building those coalitions, because no one partner can do this all on their own. And just wanted you to think back, what were the differences in the types of partnerships you had to get together for hepatitis B vaccination implementation versus hepatitis C treatment access?
Well, that's a question which has many aspects on how to comment. Hepatitis B vaccination was probably easier because of a couple of situations. First of all, the Minister of Health at that time came from our institution, so we had a closer approach with him. Second, it involved mainly children, and children is a very sensible topic when you come to prevent disease in children. So that was also very important. Third is that Mexico has a tradition in vaccination programs for many, many years. So the only thing we had to convince the government was to include hepatitis B vaccination into a program which they already had of vaccination for the rest of the children. So all these factors contributed to make it easier to convince the authorities about getting the vaccination. The other thing I have to say with it is we went to the parliament and we vaccinated everyone in the parliament for hepatitis B. And that was an important event because it spread the knowledge of vaccination. And so I think that was a easier program. In relation to hepatitis C, I have to say it took us a couple of years to convince the authorities, because there were different aspects. With hepatitis C, people that are infected do not know they have the disease. So we had to develop an approach of how to screen the population also. And it was at the beginning only with molecular biology as the first approach, and that made it very difficult. But once we get the point of care testing, the rapid testing, that helped us to develop the approach of how to screen the population. And as soon as we get a positive one, then we go and do the PCR to confirm the diagnosis. But that made it difficult in the way of detecting the population. And the other thing had to do with the access to the medication and the pricing. So there were different problems in each one of the approaches. That's why I say hepatitis B was easier to convince than hepatitis C, but we finally came through, and now fully committed to eliminate hepatitis C by 2030.
That's great. That's really exciting to hear you state that so clearly and so confidently for Mexico. In that regard, what's the work left to be done? What do you think is some of the tougher assignments? Sometimes we hear about treatment of incarcerated populations, people who inject drugs, rural communities that may not have a quick access to a doctor or clinician trained to deliver these medications. Really would be interested to hear what you see as the major challenges for Mexico going forward.
I think the major challenges are several. One is, why did the government choose, or the health authorities choose, to incorporate the people that had the experience with HIV? That is very important because they already have a structure. And then we realized that if we do not have a harm reduction program by itself, it wouldn't be able to get a success in people that have addiction to drugs. So we had to set up on a side a program of harm reduction on these populations. And that is also important when you speak of some populations as persons in prisons, etc. So we had to do an approach of going as it is said this year, the program is to found the millions of persons who are infected. So we decided to have a micro-elimination program in some specific points. At the same time, we realized that being such a huge country in size and with an heterogeneous system of health, we needed to have the primary physicians involved into the care of screening and treating these patients. So we have to develop a program about the capacity of them to being able to participate. So the program started in October, and we're only by now starting to implement the program fully. So it takes months of preparation in order to have the program really in quality and in good place. So I think one is having the primary physician level physicians involved. Second is not only to go to test the people who take drugs or are in prison, but to have a harm reduction program at the same time. So we try to prevent the incidence of new cases. So we're right now working hard to develop programs in relation to prevention of the disease. And that's where the the civil societies are very important to develop preventive measures in the future. I think COVID-19 is going to be an ally of us, in a good alliance, because people is learning the importance of prevention for COVID-19, and we can use the same to try to develop programs of prevention for hepatitis C. Hepatitis in general, I have to say.
Right. No, that's very good to touch on COVID-19 and some of the opportunities coming from that. I really encourage you to share some of these valuable lessons learned and with others on the as being a partner in the Coalition for Global Hepatitis Elimination. I also hope that the coalition can get you more fully connected to some of the others around the world, tackling these same problems for access and treatment success for people who inject drugs, so that you can both prevent transmission by harm reduction that includes testing and treatment. Before we close, I just wanted to see if there were anything else you wanted to remark upon about your work in Mexico, and any messages you have for people around the world here as we're approaching World Hepatitis Day.
Well, I would also like to mention that I forgot that people co-infected with HIV and Hep C is a group in which we want to see the elimination, one of the first groups we want to eliminate the disease. What I would like to leave as a message is that it's not a question only of economical resources. It's not a question about pricing of the medicines. It's not a question of the budget of the government. But our responsibility as physicians is try to get innovative approaches of how to solve the problem. And I think the only thing we can do as physicians is, as you mentioned, is to understand that global health is very important. And I hope that the example that of what we're doing in Mexico would help the Latin American region to be able to find ways to oversee the hurdles that represent treatment of hepatitis C. I think it's a responsibility for physicians because we know that the disease is curable. We know we can prevent liver cirrhosis. We know we can prevent cancer. So it's now in our responsibility to find ways of how to improve the access to treatment to the population. Years ago, we wouldn't look for hepatitis C because we didn't have the medicine. But now that we have the medicines, we cannot say, I don't test you. I need to test you if you have a risk factor. So I think that's an important message.
Thank you. Well, thank you very much, David. Really, thank you again for your work. This is Dr. David Kershenobich from Mexico, a 2020 Global Hepatitis Elimination Champion.
Thank you.
Thank you.